All right, so I'm Tara Laws. I'm with Low Cost Pet Vax, and this is Dr. Rodney Munsell. And we are here to talk about screwworms because there is information all over the place going around right now. And so, Dr. Munsell, tell us a little bit about this screwworm epidemic that's going on.
Well, most people have heard on the news that we have a agricultural crisis and can't move cattle, and cattle farmers are going to lose a lot, and even our pets are at risk. So we want to give you some information. A screwworm is, this particular deal is basically a larval offspring from a fly.
Okay.
A certain kind of fly. It's called a blowfly, a little bigger than most. And the terrible thing about screwworms, why it's such a big deal, is the larvae. Most everybody's heard about maggots, right? Nobody likes maggots.
No, they're gross.
But maggots only feed on stuff that's dead.
Okay.
Screwworms actually, their larvae will feed on living tissue.
That is appalling.
That's what makes it so devastating and dangerous.
Okay.
And you might say, screwworm, how did you get the name? Well, when you look at these larvae, they and they're in feeding, they appear to be turning. That's how they got the word screwworm.
Okay.
But they do tend to, the female fly, she can lay like 2,000 eggs over her lifetime, which is only about probably 2 weeks. But they typically lay either right by an open wound.
Okay.
So open wounds are dangerous with these guys.
Okay.
Or they can lay eggs close to mucous membranes.
Okay.
Like in ears or by the eye or in the nose.
Okay.
I don't mean to gross you out, but anyway, so.
Okay. What do they look like? Like, what should we be looking for? Because now that you mentioned, your mucous membranes, I'm assuming that we should probably keep an eye on those areas.
Perfect idea. Kind of jumping into that. As they get started, and these eggs that get laid, they typically hatch less than a day. They're They're on it, and they start feeding within just right away.
Okay.
What would it look like? It looked like an open wound that just smells horrible.
Okay.
As these things, and so many of them get started. Remember I said they lay, typically in batches of like 400 or so, but that's a whole bunch of screwworms all at one time. And so they attack a wound, or even just, especially in something like the respiratory tract, the nose or the ears.
Okay.
It would be just a nasty, wet-looking wound that just smelled terrible. Obviously, they're going to cause behavioral changes. And as we're kind of considering, cattle are one thing. Sheep, goats, wildlife, anything that's warm-blooded is a problem for these guys.
Okay.
But they can even infest our pets, dogs and cats. Okay. And so if you're thinking, how's the best way to kind of deal with that? One, kind of check your pet out, especially if it is outside a fair amount. But if they have a screwworm problem, you're going to know.
Aside from it being, gross, is it life-threatening? Why is this such a huge deal?
Typically, it's not going to be life-threatening to our pets because we see them, we have hands. We're going to catch it soon enough. If you have a calf that was just born a week ago, that would be a prime target for screwworms.
Okay.
And if it is infested by screwworms, it can easily be dead within a week.
Oh, wow. Okay.
So yeah, it is deadly, but wildlife is certainly going to be a big problem.
Okay.
Anytime reproduction occurs, that's always going to be an issue. Any wound scratch is an opportunity that these female flies that lay these screwworms, they are attracted to.
Okay. Is this the screwworm? You know, I've also heard about eradication, and you know, is this something new, or is this something that we've seen before in the past in history? Like, help me understand what the life cycle and the history of this organism is.
That's a great question. And obviously, when you get as old as me, you kind of saw this way back when. But yeah, this was a huge problem, certainly all the way up through the southern United States.
Okay.
70 years ago.
Oh, wow. Okay.
It was a problem for a good many years prior to that. But eradication is the word to use. That about the early 70s, we, by various protocols and programs, we pushed it south.
Okay.
Never got rid of it.
Oh.
But we were able to push it past our border, out of Mexico, out of most of Central America, and the quarantine area was Panama.
Oh.
Panama's kind of the magic country of this whole deal. It's always been there. It never completely got away. But, you know, it's history, you know, how did we get rid of it last time? So you're probably thinking, well, they just do that again.
Yes, that's exactly what I'm thinking. I think we should go with plan A.
But if you kind of consider that it started in Panama and it broke through that quarantine and then started spreading through Central America and kept going, marching. It was in Mexico 2-3 years ago.
Oh.
But it kept going. And we're not ignoring it. We're doing stuff that we did last time, but we're not doing everything we did last time.
Okay.
And you're probably thinking, well, whatever we're doing, it ain't working.
Yeah.
Because it just kept coming. And now started off with 2 cases in Texas. Well, 1 case in New Mexico. And now there's, I think, on the 23rd, I think I looked at, there's like 16 active cases now in Texas.
Yes.
It's blowing up. So the cattle industry is going to be an issue for a while because whatever we're doing just isn't working.
Okay. All right. So I hear you talk about a lot of the things that we've done in the past to handle this. What are we doing today to try to get ahead of this thing and try to get this thing pushed back?
Yeah. Well, one of the really neat things that they came up with that worked as part of a larger program 70 years ago is they came up with a way to sterilize male flies.
Okay.
Produce sterilized male flies.
Okay.
And one of the really neat, I don't know if it's neat, but interesting things about the screwworm is females only mate once in their life.
Okay.
So if you can get a sterilized male hooked up with a reproductive female, game over.
Okay.
For that fly anyway.
Okay.
So we have a lab actually in Panama that generates hundreds of millions of sterile flies. One of the techniques of dealing with this that worked in the past, as part of a larger program, but is releasing millions of sterilized flies. And with the hope that some of the sterilized male flies will find a reproductive female fly, and for that fly, it's game over because they only mate one time.
Okay.
And that certainly helped, made a big deal. That is what we're doing now.
Okay. So why is it not working as well?
Because last time, that wasn't all that we did.
Oh.
We did basically what you would think you do when you have flies or mosquitoes around. Use some kind of a pesticide, right?
Yes.
Duh, yeah.
Yes.
So anyway, there was a specific kind of a baited pesticide that was used that it eradicated or wiped out probably 80% of these things. And the mop-up deal were the sterilized flies.
Okay.
But right now, that's all we're doing is the sterilized flies, and it's not working.
So is this something we can purchase at Walmart? Why have we not done this?
Yeah. This would have to be done on a huge scale.
Okay.
I said, there's maybe 16 active cases in Texas right now.
Yes.
I think there's and don't hold me to this, but I think I looked up, like 17,000 active cases in Mexico.
Oh, wow.
It's completely out of control all the way up to our border, and I don't have a whole lot of hopes that we're going to get control of it because we're not doing the one thing that we're doing part of the program that we did last time.
Okay.
And I can only, expect that, kind of the whole ecological, armies, we can't do anything, that would hurt anything. Mm. And I'm pretty sure the outcome is going to be our whole agricultural program is going to get hit hard. You think meat's expensive now, it's probably going to be quite a bit more expensive because it costs a lot of money to do other things. But anyway, like I said, one of the bigger deals that we did last time was a baited pesticide that did the heavy lifting, but we also did this sterilized flies. The sterilized flies, sounds like a really neat thing and, pretty cool, but they can't just produce male flies. So when we release these millions of flies, we release, say if we release 1 million, we release 500,000 males and 500,000 sterilized females.
Yeah.
And they're pretty aggressive at reproduction, and most of the time, most of what you're going to get is a sterilized male mating with a sterilized female. So they never get to the actual target. Some do. Some do, but one of our main deals with low-cost pet vacs is to inform our clients. And one thing that I am kind of suggesting to our clients, this is not going away anytime soon.
Okay.
We would have to have a whole change in how we're dealing with this because obviously just doing this, and they're talking about doing a whole lot more of what's not really working.
Okay.
Just doing more of it, which I don't really expect that's really going to change the deal. And I expect by the time they get that done, it's going to be, Texas will be completely engulfed in screwworms.
Okay, so obviously I feel like we should talk about what can I do to help and what can I do to protect my pets and myself.
That is the information our clients need the most. And the great news about this is that our clients already have the medications that will pretty much 100% prevent this.
Okay.
They are these latest and greatest flea and tick medications that we're using now.
Okay.
They pretty much 100% on this stuff.
So I thought they just did fleas and ticks and heartworms. So how are you saying they will help with this?
Yeah. Well, actually, most of these are the new oral medications
Okay.
that we give. They're not quite as cheap as, the pour-on deals, but that's because the pour-on deals stopped working a while back.
Yes.
Or we would still be using those, right?
Yes.
Because they were cheaper. But these medications, actually in the veterinary community, we actually deal with a number of other parasites, or use them, treat a number of other parasites with these drugs.
Okay.
Like mites,
Okay.
sarcoptic mange, demodectic mange, ear mites.
Okay.
I don't know, what am I forgetting there? Any kind of...
Worms. The worms.
The ones that I'm specifically talking about, the ones of a class called isoxazolines.
Okay.
I can't say that again. I'll mess it up. But brand names of those are, Bravecto is probably one that most people are really aware of. We carry one of the newer ones called Credelio.
Okay.
Credelio Quattro, something.
Okay.
And that one has actually been licensed specifically for treating this.
Oh.
But really, all of these drugs, Simparica is another one that we carry.
Okay.
All of these drugs do basically the same thing.
Okay.
So if your dog is on that, we would still recommend all of our clients be vigilant and, kind of looking for stuff. If they have a little scratch or something, keep an eye on it.
Okay.
But if your dog's on those medications, you just really don't have to worry. Or your cat. We have Bravecto for cats. All these drugs are very safe. The only contraindication is if a dog already has a history of seizures, that you want to be careful using them because.
Okay.
But other than that, apart from that, just to throw out all the information that I can think of, there's also a drug that we used to use that was real effective for fleas for about 48 hours maybe.
Okay.
It's called Capstar.
Oh, okay.
Nitinpyram, or I don't know how you say that word, but anyway, that's close. That drug also works, but it wouldn't have any long-lasting prevention. Like it works for 48 hours, and so it could treat if you found something, but I would certainly stay with these other long-lasting products.
I'm going to buy a fly swatter just in case.
Yeah.
Just to have around, like I'm not feeling too secure.
Kind of therapy, right?
I'm really thinking so.
Yeah. We also have this new 12-month injectable,
Okay.
Bravecto Quantum,
For fleas and ticks?
for fleas and ticks.
Okay.
Same kind of drug. Protect against this for a full year.
That sounds amazing.
Pretty cool.
I would much rather
Pretty cool.
not give a pill every month.
Yeah, our clients really need to be vigilant. Keep an eye on your pets. Some of these isoxazolines just take the worry right off the table.
Okay.
But apart from that, if a dog, stayed outside, forever and maybe got into fights, and somebody didn't look at him, big risk.
Okay.
He would be one that would, or she, that could easily, you not see him for 4 days and them have just a huge wound with all these maggot-looking things, and just a terrible stench come from these wounds.
Oof.
So, but for our clients, not a big worry.
Okay. I mean, obviously this is a big deal. A lot of agencies are getting, involved, and there just seems to be a lot of uproar kind of about this. If we do think that we found this, is there anything that, extra that we need to do? Do we get them to a vet? Is there anything extra that we should be doing if we think we have one of these cases?
Exactly what you said.
Okay.
First is get it to a vet.
Okay.
Because one, it's hard for, a client to diagnose that it's this and not just, some flies, and regular maggots.
Yes.
They look fairly similar. But if you see these actual larvae and they look like they're twirling,
Okay.
it's a screwworm. That's how they got their name.
Okay.
But get them to your veterinarian, get it treated. Your veterinarian will want to take samples of these things and send off to some of these federal labs, to diagnose the case. What I'm about to say doesn't apply to our clients and our pets too much. But one of the problems that is going to work against us is that there's some of these older ranchers, they're kind of leery about having, a lot of oversight. And if they report something, some of them are going to worry that, they're going to lose their whole herd or something like that. But that's not the case. If you stay on how these things are treated, they treat the one case and have a surveillance, but, people aren't losing their whole herds.
Okay,
But,
good.
We talked about the animals that are at risk, certainly all livestock, wildlife, and even our pets. We got rid of it one time.
We can do it again.
We should have. It really should have never come past Central America if we were doing what worked last time. But it's been marching up for probably 4 years. Again, I don't want to harp on this too much about what we're doing is not working, just to let our clients know this is not going away anytime soon, in my opinion.
And it's not new. It's something that's been around.
Yeah. It sounds weird that a larvae from a fly is going to be this disruptive to our agricultural community, but I think our clients can probably do what is needed for them to have very little concerns about it, and to protect their pets really easy with some of these, flea and tick medications that we have now. They're that good.
I'm just amazed at, thinking about some of the things that you've said. I'm just amazed at how fast the life cycle of these things are. I mean, it seems like this could get really big really quickly.
You're exactly right.
And that to me is a little scary because, gosh, if we don't get ahead of this thing, it could just become very massive.
I don't want to sound like a doom and gloomer, but I'm pretty much a doom and gloomer for this. We started out with 2 cases in Texas 2 weeks ago. Now there's 16 cases. It's already moving in Texas. And until some of our policies get back to doing what actually the full deal that we did last time that worked, doing more of what's not working isn't going to fix it. But you're right, it can explode because, like I said, a female in her life cycle of maybe 2 weeks can lay probably 2,000 eggs. And if those 2,000 eggs hatch, and half of them are females, you have another 1,000 that each lay 2,000 eggs, it can move real quick.
I can't even get rid of the mosquitoes in my yard, so I don't, I don't think, I wouldn't want to go up against flies either. So.
Anyway, that's about all I got.
Okay, all right.
Well, thanks for the questions.
Yeah, of course. I'm glad that we could talk about this and really dive into it because I think, coming from somebody who, I'm glad that we're farther north than where it's at right now, but at the same time, I also, I see it pushing this way, and so I want to be better prepared for when it actually does reach us and reach our counties.
Yeah, it's already, as far as pushing north in Texas, the farthest north county is a county just west of San Antonio. But it started, of course, on the borders, towns. Had one in New Mexico, but it's, I think by this time next month, the middle of next month, I don't expect the best.
San Antonio is close enough for me. I
Antonio,
really hope they just keep that down there and we control it.
Yeah.
So,
But anyway, if our clients or anybody seeing this, if you have other questions, certainly, how do we answer questions? Like anything through Facebook or social media, they can send questions, they can,
we do
Email
have
them.
some,
yeah, all those social media things, yeah.
yeah.
Give us a follow, yay.
Okay.
All right, have a good
That
day.
sounds good. Thank you so much, Dr. Munsell. We really appreciate it.
Bye, guys.